On July 27, 1989, 51-year-old Gordon Hanson was arrested for cultivating his own medicine. An epileptic since 18, Gordon had been using marijuana for 10 years to successfully control his seizures. In the 11 months after his arrest, while denied his medication, Gordon suffered 2 grand mal and 85 petit mal seizures. In this program, you will meet the first 5 patients in the United States with legal access to marijuana. They are Elvie Masica, Corinne Millett, George McMahon, Irvin Rosenfeld, and Bob Randall, founder and president of the Alliance for Cannabis Therapeutics.
I think that the first thing you should know about me is that I use marijuana medically and that I have a disease called glaucoma. Glaucoma is the leading cause of blindness in the United States. I was diagnosed at the age of 24. At that time, I'd already lost 85% of the vision in both eyes, and my physician, who was a noted pathologist, concluded that I had 3 to 5 years of remaining vision, even with the best possible medical care.
It is now 1992, 14 years later. Bob still has his sight, and the critical difference has been the medical use of marijuana. Evidence of marijuana's medicinal use can be found throughout world history. Looking at American history, you will find that from 1850 to 1937, tincture of cannabis, an oral preparation of marijuana, was prescribed as the prime medicine for more than 100 separate illnesses or diseases in the U.S. pharmacopoeia. Some of those illnesses included insomnia, loss of appetite, nausea, depression, migraine headaches, menstrual pain, and spasticity. Unfortunately, a national campaign of reefer madness, fueled by hysteria and racism, resulted in the passage of the Marijuana Tax Act of 1937.
Your Honor, in this case, the state waived trial of the defendant, Ralph Wiley. It is convinced that he is hopelessly and incurably insane, a condition caused by the drug marijuana to which he was addicted.
Because of this political action, marijuana was removed from the U.S. pharmacopoeia over the objections of groups such as the American Medical Association.
The American Medical Association did not believe the government's claims about the dangers of marijuana, smoked or otherwise, and they certainly did not want removed from American physicians the ability to prescribe the then available therapeutic preparation, which was an alcohol-based tincture of cannabis, which physicians used, and the AMA obviously thought they should have the right to continue to use.
The passage of the Controlled Substances Act of 1970 further removed marijuana from medicinal drugs, giving regulatory power to a law enforcement agency rather than the medical community. This resulted in marijuana being incorrectly placed in the most restrictive of 5 schedules, Schedule 1, prohibiting research and prescription.
Like many patients, I discovered that marijuana was helpful by accident. I was having symptoms of elevated pressure inside the eye, in my case, tricolored halos around sources of light. Discovered that smoking 2 marijuana cigarettes resulted in those halos disappearing within 45 minutes. There was an immediate understanding that marijuana was medically helpful. But because the drug is illegal, I did not inform my physician. He was simply pleased that my disease was suddenly, miraculously, coming under control.
Glaucoma is a condition which causes pressure to increase within the eye. Allowed to continue, this pressure can lead to blindness. For reasons not yet completely understood, marijuana reduces this pressure differently than conventional medications. The health risks are minimal, and the patient can easily titrate for the lowest therapeutic dosage.
He told me that I would be blind in 3 years. That's how serious the situation was. And I went through several surgeries, one of which was a procedure which took 21 shots applied directly into the eye for the next 2 weeks following surgery. Twice a day the first week and once a day the second week. That failed. But he said, in your case, your pressures must be maintained at 12 because you have a very, very sensitive optical nerves. They scheduled me for emergency surgery on the right eye, which was my better eye, but which had the higher pressure at the time. I went home and ate marijuana brownies, and when I returned to Bascom Palmer, my eyes had absolutely 100% normal pressures. One eye was 14, one was 16, and they couldn't imagine how I did it. I was very open from the beginning and told them not only that I did it with marijuana, but exactly how I used it. Many years later in court, I found that they never made a notation as to how these pressures dropped so dramatically, but nonetheless, the record is there to state that they did, and there were no other answers.
It was difficult to believe that a weed that grows out of the ground, which is illegal, which I had used and associated with pleasure, was going to prolong my sight when modern pharmaceutical agents and the best available medical care were not achieving that effect. After 6 months of trial and error, however, it became obvious that marijuana was helpful.
I found with my first marijuana cigarette, I was told I really should sit on the bed and listen to some music or do something pleasant and not to dwell on the fact that I was smoking a marijuana cigarette, but enjoy it, which I did. Upon putting the marijuana cigarette out, it must have been about 10 or 15 minutes later, I felt like I'd had one martini, and that was all. I had no adverse side effects at all. And I did find also that the street marijuana completely relieved my arthritis pain. I mean, it was so wonderful to be completely out of pain for once. I was elated.
As Corinne noted, glaucoma is not the only illness helped by marijuana. Marijuana plays a role in cancer treatment by alleviating the nausea and vomiting associated with chemotherapy. Marijuana is being used successfully for epilepsy to control and reduce seizures. Marijuana is benefiting many AIDS patients suffering from wasting syndrome. Marijuana is helpful for chronic pain problems such as arthritis. And marijuana decreases the spasticity associated with multiple sclerosis and spinal cord injuries.
I have a condition called nail patella syndrome, referring to my fingernails and my kneecaps. I have bone or joint degeneration similar to osteoarthritis. I have organ problems and spasticity, muscle spasms. At this point, although we're not sure why, a lot of nausea. I've had 19 major surgeries. In 3 places on my body, they've cut me in half, across my trunk, my leg, and my arm.
I have a bone disorder called multiple congenital cartilaginous exostosis and pseudo-hypoparathyroidism. This is bone tumors on the end of long bones. Causes considerable pain, causes considerable muscle tension. I can hemorrhage quite a bit. I can tear muscles. Besides, these tumors can have a 25% malignancy rate. I've had over 8 operations, and fortunately none of them have gone malignant yet. But it still causes me a considerable amount of problems in everyday life.
6 months ago, a little over that, I was wearing a brace from here to just above my groin that had to hold front and back and hips. One on my wrist, an arm, often on, mostly on, and one on my leg. These were all the time. So from my ankles to my chest, I was pretty much on the right side in braces. I tried to cover all of the things that marijuana does for me. And if you did, it would probably take about 15 pills 3 times a day.
My intake of more potentially harmful medications, such as Dilaudid 4 milligram, was now being decreased. It seemed to enhance the effect of the medication I was taking. That's what seems to work for me as an adjunct medication and as a muscle relaxing agent that takes away the pain.
I've reduced from up to 8 Percodans a day to none. And I believe I had been taking them when I got the prescription. It had been about 6 months daily, 4 to 6 a day. But I also quit without any withdrawal symptoms, none.
Marijuana has been proven safer and more effective than many commonly prescribed medications and procedures. The worst side effect identified with marijuana as medicine is its illegality.
Had been really fed a great deal of misinformation regarding this particular substance, and I wasn't particularly happy about having to deal with the illegality of it and the fear that it would have serious repercussions regarding my job and my children.
But again, I still had to be a criminal to go out on the streets to buy it and deal with the criminal element. I didn't like that, being a furniture store owner. I was a businessman. I didn't like that aspect of it. How do I get it legal?
I ran into a problem that many patients confront, and that is, how do you obtain an illegal drug you need on a consistent basis? Marijuana, when it's illegal, is very expensive. The market is chancy and risky, and in order to escape that market and to assure myself a constant supply, I grew 4 marijuana plants in the middle of downtown Washington, D.C. In August of 1975, I went on vacation, and when I returned, I found that my plants had been stolen, and when I opened my house up and looked in the kitchen, I found a search warrant indicating that the thieves had been from the D.C. Vice Squad, and they had left a message that they would like me to turn myself in for arrest.
Like Bob Randall, Elvie Masica was also arrested for growing her own medicine.
Judge Mark E. Poland found that medical defense was applicable in my case, that I neither created the illness nor the cure for it, and therefore that it would be extremely unfair. He called the law intolerable, as I recall, and I was acquitted on August 15 of 1988.
I have, since 1976, received 10 marijuana cigarettes a day by prescription for use in the control of my glaucoma. In that period of time, marijuana has successfully prevented any progression in my disease. My eyesight, while fragile, is stable, and 14 years of additional sight means a great deal.
And this time, the doctor felt that they were going to try a laser, which is the least harmful of all, and they did not expect any problems. Unfortunately, I hemorrhaged shortly afterwards and lost complete sight of my right eye. Let's face it, any surgery is risky, no matter how minor. I submitted myself, my better eye, to the surgery in the hope that science really could come up with another answer.
Recently, the Drug Enforcement Agency was ordered by the U.S. Court of Appeals to consider the question of marijuana's medical availability. In conclusion, the DEA's own administrative law judge determined that marijuana had legitimate therapeutic uses. After reviewing over 5,000 pages of evidence and hearing testimony from over 60 witnesses, Judge Francis Young ruled that there is accepted safety for the use of marijuana under medical supervision, and that to conclude otherwise would be unreasonable, arbitrary, and capricious.
Unfortunately, DEA has refused to abide by the judge's verdict, and in December 1989 upheld its own bias and said that marijuana would not be made available as a medication.
This drug is, as the judge in the federal case said, probably the safest psychoactive chemical that humans have ever consumed.
My sight means more to me than to be afraid of a plant. But there's nothing to fear about marijuana except the illegality of it. Take my word for it. I've tried it for 14 years now.
All the people I knew could see there was something about this that worked for me, but who I couldn't get through to was the doctors. I could not. It's illegal, it doesn't work.
It's very frustrating for me to know that there's all these people out there that have no idea what they should do. They're going blind. They're losing their sight. They know they are. They don't know what to do. They don't know who to write. They don't know who to call. They don't know what they have to have. This is very upsetting to me because these people are desperate, as I was desperate. I don't want to be blind. I don't want to be I'm any more than a handicap than I already am. And I don't feel this is justifiably honest for this country to deny these people this information. And who is doing it? Who? Why? I don't know.
And from here, I'm hoping that we're close enough with the reclassification of marijuana that there will be the people who need the medication will be able to get it.
Unfortunately, in February of 1992, after receiving hundreds of requests for legal marijuana from the AIDS community, the Department of Health and Human Services closed the investigational new drug program to all new applicants. How can we stand by while our federal government denies patients legal access to a medicine they so urgently need? Attempting to keep your sight or ease your pain has become, through political posturing, a law enforcement issue, not the medical issue it should be. Since this program was taped, Corinne Millett had her medicine arbitrarily taken away for 6 weeks without her or her physician's knowledge or consent. Corinne permanently lost 80% of her peripheral vision during these 6 weeks.